Hello there, lovely good afternoon and welcome to Lunchtime Church on KBN TV, the finest television in Zambia and now showing in more towns across the country. If you're joining us on the Topside decoder, it is channel 102, and on Facebook it is KBN TV. Make sure to subscribe to our YouTube channel. Leave us a comment on Facebook and get interactive with us on the number that is scrolling on your TV screen this afternoon. Now, the Medical for Quality Healthcare in Zambia has released a statement demanding that government should dissolve NIMA. Now, NIMA is National Health Insurance Authority, and the executive director for MQHZ, which is Medical for Quality Healthcare in Zambia, Dr. Mwabu, earlier this morning issued a statement, and he will be joining us remotely so that we get to find out why he wants or why his organization is requesting that government dissolves NIMA. Now, before we even invite Dr. Mwabu on the program, I would like to give a brief background about the National Health Insurance Management Authority, NIMA. Now, NIMA is established pursuant to Section 4 of the National Health Insurance Act number 2 of 2018. The compulsory National Health Insurance Scheme seeks to provide for a sound and reliable healthcare financing for Zambian households and the entire health sector. This will seal the resource. Now let's look at some of the functions of NIMA. The functions of NIMA are as follows. Of the authority is to implement and operate the National Health Insurance Scheme, manage the National Health Insurance Fund, accredit health insurance healthcare providers, develop a comprehensive benefits package to be accessed by members, register and issue membership cards to members and facilitate member access to quality health service. Okay, so those are some of the functions of NIMA, which is National Health Insurance Management Authority. And Medical for Quality Healthcare in Zambia is urging government or calling on government to disband NIMA, and we'll be joined by Medical for Quality Healthcare Executive Director Dr. Quincy Mwabu, who's going to help us to discuss this very important subject. Okay, we now take a break, but do join us with Dr. Mwabu on the other side.
Audio Jungle.
Okay, so thank you so much for you all our viewers out there, wherever you are watching us from. Are you in Central Province, Southern Province, Western Province, Northwestern, Muchinga provinces, or Eastern Province. Thank you so much for joining us on Lunchtime Chat Show. Now we have Dr. Mwabu joining us remotely. Doctor, good afternoon and welcome to Lunchtime Chat Show. Okay, so Dr. Mwabu will be joining us remotely. As you are aware, the Medical for Quality Health in Zambia has issued a statement urging government to dissolve NIMA National, NIMA, which is a management authority that most civil servants subscribe to, and they have continued seeing deductions from their salaries. But MQZ is suggesting that this very organization needs to be dissolved. Dr. Mwabu, good afternoon and welcome to Lunchtime Chat Show.
Good afternoon, sir. How are you?
I'm all right, Dr. Mwabu. How's the afternoon so far?
Great. Hope I'm clear.
Okay. So, Dr. Mwabu, earlier today you issued a statement demanding that government should dissolve NIMA. The question that arises is, why do you want NIMA to be dissolved?
All right, sir. Thank you so much. The answer is very simple. Because NIMA has failed on its mandate. So if something failed, if they are failing to do their job, then what's the point of having them? Because we have been observing the mandate of NIMA and the way they have been operating. And looking at the members who are under NIMA, they have been just coming out with prescriptions, and in their mandate, nowhere where it has written that prescription is a part of which people need to take. No. So members of NIMA, a lot of them, because we have been investigating, a lot of them they have been complaining that sometimes they can go in these institutions that are accredited by NIMA, but they can just spend a lot of hours on the queue and coming out with a piece of paper where the doctor or a clinician he has written some medication which they need to buy. So what's the point when you are being deducted from your salary, your pay slip? Then at the end of the day, when you go to this accredited institution which is under NIMA, then you end up coming up with a piece of paper to go and buy medicine using your own money. So that is unacceptable. It's unacceptable because we hoped that this NIMA could have helped a lot of Zambians, especially poor civil servants, to make sure that they receive the quality healthcare services. But they are no longer receiving services. At the end of the day, they are just spending their own money to pay for these services. So NIMA has to be disbanded because it has failed on its mandate.
Okay, now let's look at some of the functions of NIMA, Dr. Mwabu. One of them is that of to manage the National Health Insurance Fund. The other one is accredit health insurance, healthcare providers. Is it failing to carry out these functions that it are stipulated?
Looking at their functions, this NIMA, they need to accredit some health institutions, including private and public institutions, health institutions, and they need to be providing the funds since they are deducting the funds from the civil servant and other people. So they need to make sure that these institutions that are accredited, that are under NIMA, they should receive funds to make sure that all the essential medicines that are under NIMA, they need to be provided, because on the list of essential medicine, they've got a lot of list of essential medicine and some certain procedures which they need to pay for. But when you see the member of a member of the scheme go to these accredited institutions, then coming out with a piece of paper, which we call prescription, to go and buy the simple essential medicine like ibuprofen and ciprobid. Then what is NIMA doing? Because they need to provide that. They need to provide the funds institutions so that they buy medicine to give to these members who are under NIMA, who have been paying for these services. So if they are not giving out the funds to these accredited institutions, then what is going on? Because they need to be funding these institutions so that they are stocked with all the essential medicine that is under NIMA, than giving out piece of paper to the members who are under NIMA or who are under this scheme.
Okay. Now, looking at NIMA itself, it says it seeks to provide for a sound and reliable healthcare financing for Zambian households in the entire health sector. Now, I would like to find out from you, Dr. Mwabu, you have earlier mentioned in your preamble that NIMA is failing on its mandate. Now, looking at this very sentence here, where it says it seeks to provide for a sound and reliable healthcare financing for Zambian households and the entire health sector. Now, in general, is it failing to provide a sound healthcare for Zambian households and the entire health sector? I want to get it from you.
What is important to NIMA is to provide the access, okay, access to quite healthcare services to all Zambians.
Okay.
So that is their mandate. They need to provide that. What NIMA should do is to make sure that these services are being provided in all the health institutions. Because when we are doing investigation, we talk to members who are under NIMA, or especially the poor civil servants who are under NIMA, and the majority they are complaining. So this is the reason we are saying that they are failing on its mandate. There are few people who might be benefiting, but when the majority of people are complaining about their mandate, then they are failing, because the majority of people, they should not be complaining. But if few individuals are the one who are benefiting when it comes to these schemes, then what are we doing? Then we are doing nothing. Because majority of people, especially poor civil servants, should not be complaining. Because if they start using their own money to buy medicine, then they go to the health insurance that are accredited with this NIMA. Then they come up with a prescription. Then they go and buy medicine. Then people will complain. So that's the reason we're saying that if the people, members who are under NIMA, they are complaining, if the majority are complaining, then they are failing. So they need to put their house in order to make sure that the majority, they start benefiting when it comes to this scheme. Majority should benefit, not only maybe few, 3, 4 people come up to say that we are, no, that is unacceptable. Majority of people, they should benefit, especially if when they are deducting from their payslip, they have to benefit, because they do deduct every month to make sure that tomorrow, if a person gets sick, because no one knows what tomorrow happens, if they have been deducting, you have to go to the clinic. So NIMA, they just have to pay. But if you go to the institutions that are accredited under NIMA, then you go there, then they tell you that we have not received the funds, so this services is not available. Then what is that? That is unacceptable. So they need to put their house in order to make sure that they do what is right, to make sure that the majority, especially members who are under NIMA, they should not complain. Because when we are doing the investigation, we talk to the people who should be benefiting when it comes to this scheme. So as MQHZ, our aim is to make sure that we protect the people of Zambia. They need to benefit when it comes to these services. We stand for the people of Zambia. They should benefit, because these services is for the Zambians, so they should benefit. So if we come up with any services, especially if we come up with a scheme like the insurance scheme, health scheme, the majority, the poor, they should be benefiting, because they are contributing every month so that they can receive the quality healthcare services each and every day when they fall sick.
Okay. Now, Dr. Mabu, you have talked about, in your statement, you have talked about uh, urging government to make sure that it dissolves NEMA. Now, I'd like to find out from you, have you tried to engage the line ministry so that this matter can be addressed before government can even suggest or on dissolving NEMA?
Yeah, we have been making appointments to meet them so that we can advise them. But it was come to, like, we don't usually come up with a program to make sure that we sit and make sure that we advise them. Because as we are stakeholders, we make sure that we provide checks and balances to these institutions that are under the Ministry of Health. Those are public offices, and you have the right to question them, and we need to push them to do what is right for the benefit of poor Zambians. So we are there to make sure that we push, we press them so that they provide the services. The services should not be on the paper, no. The services should be disseminated or should be supplemented to the intended part, like the people supposed to benefit when it comes to these schemes. So we continue engaging them and in other health institutions that are under Ministry of Health, because we just have to make sure that we press them, they do what they're supposed to do. They should not just fit in and not providing the services which need given to the people who are contributing to these schemes, but they need to work. Then they need to organize. When it comes to the national insurance scheme, you need to be organized to make sure that you put the right thing at the right place, so that whenever you are planning, people should not be complaining. If the majority of people they are complaining about the scheme, then there's something wrong with that scheme. So it needs to be organized to make sure they put their house in order, so that majority of people that we investigate and talk to, they are not complaining, because if the people they are complaining, then there's something wrong with your house.
Okay. Now, as MQHZ, Medical for Quality Healthcare in Zambia, an institution or organization that promotes healthcare quality in Zambia, I want to find out from you, what does this mean, or what do you hope can be done away from dissolving NEMA? What do you really hope can be done?
Yes, sir. As we say that, it is very important, even in our homes. If you as a father you are not organized, the house is going to be disorganized. So it is very important each and every time be organized, so that you provide the proper services to the intended party, especially the people who are supposed to be receiving these services. So that now NEMA, they are disorganized. So what you are appealing to NEMA now, they have to try to organize so that the people, they should not be complaining, and we'll keep on watching them and investigating, because those are public officers, and we have got the right to make sure that we investigate to make sure that they are providing the good services to the people. So they need to organize. They just have to make sure that all the accredited institutions, they need to be funded, so that these institutions, they should buy the essential drugs, they should buy the machinery. They should also make sure that all the services which are needed to be provided in these institutions that are accredited under NEMA, they should be there to make sure that the members, whenever they go there, they receive these services and coming up with a prescription. So we'll keep on watching them, investigating, to make sure that we investigate until they provide the services which is needed to the members who are under NEMA. If they fail, then it has to be abolished, because that is not necessary. If a lot of people they are complaining, then what's the essence of having that institution? Then nothing. Just have to be abolished.
Okay. Dr. Mwabu, thank you so much for making an appearance on Lunchtime Chat Show. I must say, it has been a quite revealing discussion.
Thank you so much, sir. Anytime, please.
Alrighty, that was Dr. Mwabu, Executive Director for Medical for Quality Healthcare in Zambia, urging government to dissolve NIMA. Now, if you are watching us from Western Province, or you are watching us from Choma, or if you are watching us from Kabwe or Zindola, Kitwe, thank you so much for having time to tune in into KBN, the finest television in Zambia. We'll see you tomorrow, same time, same place. Good afternoon and pleasant viewing.